what would you say in your practice? What populations do you see being most susceptible to this? Like, are you seeing any particular demographics coming into your office more often than others?
Um, no, I'm not taking the detailed statistics, but I could say that I've had missed because I'm here in Florida and the city that I'm working with, they are mixed. And the more that are susceptible, it's hard for me to tell just by number.
Mm.
Uh,
Yeah, I'm asking that because with some other conversations that we've had, even like depending on just the location, there are different maybe like ethnic groups that are in that area, and in particular whether it's kind of their general cuisine and things like that. Sometimes certain practices that are built into the culture. Sometimes there are groups that end up kind of in. I'm thinking about cholesterol specifically, talking to a
okay.
doctor from Texas. So yeah, sometimes depending on the area, those groups kind of show up a little bit more. But it's interesting that your area kind of stays pretty mixed.
Yeah, it's pretty mixed. My area is pretty mixed. I have the Hispanic, the African American, white, and mixed of all. I think it's all about the level of understanding of their medical conditions as well and their standard of living per family. But if I want to go in depth, I would say that I had a conversation with one of my patients, African American, and she was more concerned about having access to the green.
Mm,
The farmers market is not as easy
mm,
like when if she's living in a different neighborhood, for instance, and because we had to talk about the green things on the plate, and that was what led to the conversation, and that I know plays a significant role because what they see most often is what they're going to buy and eat.
mm.
Yeah.
I was thinking just as you mentioned that, of course, there's obviously when we think about socioeconomic status, location, some areas are more obesogenic than others. People can't access fresh greens. Um, and then with this whole insurance conversation, that kind of throws an additional wrench in there. How are you navigating around things like food deserts and insurance coverage in general? Like, what is the fix when someone can't get access to, vegetables?
Well, that's tough.
Yeah, I mean,
Yeah, because if you can't get access, not just access, and then when you have the access to the food, the cost of the food is also important. And they put those into consideration and end up just having to eat what they have on their plate. But as an endocrinologist, and you want to make sure whatever it takes, you control their sugar, you take care of their medical conditions, then I talk more about small portion meal, like whatever food you're eating, don't eat a bulk of it. If previously you eat a big plate of rice, of bread, and of potatoes, divide it into small portion meal. Help yourself not to eat too much of all this high carb diet, just to help and keep them healthy. So these have been the alternate way been practicing.
mm.